Pretty cool. Cool. All right. So, everyone doing okay today? Fabulous. So today we're going to continue on where we left off on Friday. I know we spent more of a review day on Friday, which is fine. Not a worry. Today we're going to continue on and finish up our connective tissue. And then we're going to get into the last two of the four tissue types, muscle tissue and nervous tissue. Now, for the muscle and nervous tissue, we're just going to kind of do a scratch the surface. Just kind of what I say, a handshake, how do you do? Because we're going to do an entire chapter over the muscles and an entire chapter over the nervous. So this is just basically an introduction into them being two of alternative different types of tissues. So we're just finishing up our connective tissue. We went over and re-reviewed all of the components, like the ground substance and the different types of fibers, the different
Miss Huff,
cells.
Miss Huff, I'm sorry.
Now we're just simply talking about different categories of connective tissue. And remember, connective tissue, Sean.
Miss Huff, did you get me on attendance? I went to the bathroom.
Sharina, I don't hear you.
I think the owl is turned down.
Ma'am?
Is the owl?
I was saying I went to the bathroom and I didn't know.
Oh, wait a minute. Hang on one second. What is happening here? There. All right, try it again, Sharina.
I was saying I went to the bathroom. I didn't know if you got me as here. I'm sorry.
Oh, no worries. I will go ahead and get you.
Thank you.
Letting me know.
Sorry about that.
No worries, no worries. I'll get you right now before I forget. Done. All right, so now we're talking about just some specific types of connective tissue. The first was our adipose tissue. Adipose, we know, is commonly referred to as fat. Let's get you guys minimized so we can see everything.
Is this a new slide or did we already do this slide? We're just reviewing.
Yep, we did this slide last Thursday.
Okay. Yes.
Because we talked specifically, if you remember, about the white fat versus the brown fat. And we talked about how all of us in here have white fat. Now, this adipose tissue is connective. But the other thing that adipose tissue is our reserve for energy. So, for example, I have not eaten breakfast today. I do not eat breakfast. I usually have a Diet Coke, breakfast of champions. But it doesn't really give me any energy. Not as far as nutritional. So how am I able to be up here and functioning, and my heart is beating, and my lungs are breathing, and my brain is functioning? It's because my body is breaking down that stored adipose, putting it into my blood, converting it in my liver into glucose. Huzzah, I now have energy. We do have a second type of fat, though, which was our brown fat. If you remember, we did talk about this last week. Infants and animals that tend to hibernate have this brown fat. And what it is almost like a super, super concentrated energy source. So the baby or the hibernating animal does not have to break as much down to receive a tremendous amount of energy. What we don't want, especially if you think about our poor hibernating animals, they're hibernating for 6 months, sometimes longer. Well, they need to sporadically and judiciously break down that stored energy. So we don't want them having to use a lot of energy to get the energy they need to be alive. That's kind of counterintuitive. Yes? So whale blubber would not technically fall into a brown fat category. And honestly, I would assume it is a version of white fat because it is more connective. It is more for, what was the word I was just about to use? It's more for a connective tissue protection from the temperature versus them actively using it to break down. Because they're not hibernating and they're eating constantly.
So they're not like
Theoretically, no more than we are. They would use it as an energy source should they not be getting outside nutrition. It's called external gluconeogenesis, or the external introduction of new glucose. So they no more than what we would need. Definitely not as much as our hibernating animals. What was that? Was that Charles? Beep, bop, beep, 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 boop.
Am I beeping again?
I didn't hear that. What did you say?
you said
Can you repeat it again? Is that what you said?
Oh, so the question was about whales, and I think whales, although how much do I know about whale anatomy? I don't. I'm guessing that whales, being a mammal giving live birth, that it is very similar to what we see in non-hibernating, non-infant based animals. I'm assuming. If somebody researches it later and proves it that it is got some sort of specialty, please let me know, because I know very little about marine biology. I'm doing best guess. You're welcome. I don't think I've ever been asked a whale question before. I've been asked octopus questions and every other land animal, never a whale. So kudos to you. There's just a picture of our adipose tissue. Very spongy. We also started going over some of our connective tissue fibers. We had our regular fibers. These are in limited sites of the body. And these are going to be, they're going to resemble the connective tissue. And the reticular fibers are going to be very, very tough and help to resist stretching. We're not really going too far into the specifics behind each of these, just very basic detail, almost more like a definition. It said what? It is brown. Well, there we go. There's the thing we learned today. Whale blubber is the brown fat. I would never have guessed that, but thank you for looking that up.
Also, so Charles wanted to add that if animals live by the poles where it's cold, would they have brown fat throughout the year to keep warm, even if they are not hibernating?
I don't know. I'm not going to give you any illusion that I know anything about marine wildlife. I know you're not supposed to kill them. And oh, the only other thing
I think he meant like bears, like polar bears type of thing.
Yes, any hibernating animal. So like your polar bears, well, polar bears don't really hibernate, but your black bears, your grizzlies, any of the bears that are going to be hibernating have the brown fat. Here's the only other thing about whales that I know. And this is it. This is the last. I know that if you are in the Navy and your ship hits a whale, the entire crew gets discharged. Yeah, I'm very serious. Yep. The entire crew gets discharged. So you essentially get fired if you hit a whale.
like dishonorably discharged for hitting a whale.
Like you are kicked out. Yes.
That's crazy.
It's a humongous big deal to hit a whale. Don't hit the whale. And so that's where, because again, my I guess he's kind of my stepson, is in the Navy. He's a quartermaster 3, who's the guy that plots out. He's like the navigator. And they have to be very, very careful. And so that's one of the things that we say, oh my God, he really hit the whale on that one. Because that's the worst thing you can possibly do on the ship is hit a whale.
So does the whale pop up on their radar then? Or do you just have to look and see?
No, both. And the problem is that he is on a humongous, this is not like a little, like pontoon boat. This thing is it is a small floating city. And wherever they go into port, that's usually where the whales are. So they're already going into a narrow port of call, and there's just whales everywhere. So you just have to try and avoid them. But it's not like you can turn it on a dime. So yeah, but so that's what we say is, oh my God, he really hit the whale on that one. So
Never
here's-
heard that before.
Yeah, hit the whale. Don't hit the whale. Don't hit the whale, or you will be in big trouble.
I don't know if it's the whole ship. It'd probably be the people driving the boat. But
Well, yeah, when I say the crew, I mean the crew it's not like the cook is getting fired. It's the crew directly associated with the navigation and directional driving of the boat.
And that's like anything, not like you hit it and you kill it. Like
No,
hit
that's
it
if
at
you
all.
hit the whale, if you accidentally like brush up against it.
Just
Done. Right? I don't know, but that's all I know about whales. Don't hit them.
For my notes for this slide, I wrote, and you mentioned something about it.
Yeah, so whenever we say the word reticular, supportive.
Okay,
So reticular, even though the word reticular and hammock have absolutely nothing to do with each other, anytime we use the word reticular, like the reticular fibers interwove into a hammock, and it helps to support things like glandular tissue. So every time we use the word reticular, think supportive, and I immediately go hammock.
yeah, I didn't know if like, I just looked at.
No, you did
There was
not.
no contact with it written, it was just handicap.
Which jogged the memory. So yeah, it's supportive of other structures.
Thank you.
Yeah, of course.
I had a moment.
You're just like, why did I randomly write hammock in my notes? Are dense regular. Now remember we had irregular and irregular. Regular is where all of the fibers going in one direction, and it's going to resist stretching only in that one direction. I think on Friday we compare it with Thursday, whenever the last time it was, I don't even remember. Rubber bands. So if I have a single rubber band, very easy to stretch. But if I add more and more and more rubber bands, suddenly now it's really resisting the stretch. And that's kind of how your body is made up with these regular fibers. The more stretch we need, the less fibers you have. The less stretch you need, the more fibers you have. Because more fibers equals more tensile strength. Irregular meant that they're going in many, many directions, and they can resist stretching from any direction. One of the common places we see this irregular fiber formation is like in your joint capsules. You think about the joint capsule, it really is just like a super strong saran wrap that goes around the bones, holds in the fluid, aids in supporting, but it needs to resist stretching in every direction. So if my fibers were only in one direction, yeah, it helps to prevent them from getting stretched this way. But what happens if I take them and you have your rubber bands and I stretch them this way? Does it do anything? No. That's where we need to have these fibers in multiple directions so that we're going to resist stretching in multiple directions.
So when you pull a muscle, are you like stretching it too hard?
Oh my goodness. So the question is about pulling a muscle. And that doesn't really say, when you use the term, I pulled a muscle, doesn't really mean anything. Because there are so many different muscle injuries. Did you overextend or overflex and damage the connective tissue, tendon, or ligament? Did you damage the muscle fiber itself? Did you overwork it and simply have a buildup of lactic acid, which changes the pH and causes your body to ask you to please stop using it while we repair the damaged tissue? Did you have some sort of outside traumatic force pulling or pushing it? Like your dog jerks you the wrong way and your muscle tissue just goes, yep, nope. So when you say pull a muscle, all that really is kind of a benign term for ow, I hurt something.
It's not like the thing was very, because like when I was in like track and field, I did shot put and I threw it like a baseball and stupid and they said I tore my shoulder. But they were like, it wasn't big enough to like do anything. Is that like the same thing or you actually like staring?
So again, I don't have an answer because there's an infinite number of ways that we can hurt ourselves. Literally infinite number of ways. Did you simply bruise the connective tissue? Did you damage the muscle fiber itself, causing it to move in a way that it shouldn't have moved? Did you slightly tear that connective tissue away from the bone? Did you fully tear it? That's kind of the difference between a sprain and a strain. When you sprain something versus strain something, one is you've traumatized the connective tissue, the other is you physically damaged and pulled a little bit of it away. One is far more serious than the other. So my answer to you is depends.
So it says it's fibrous coverings as well, not only just look like a connection, but so that would be around like your stomach, your heart, is that what that's made of? Is this your regular frequency?
Like your pericardium? Yes, absolutely, because it's got to resist stretch from multiple directions. The other place we're going to see this is in like the fascia that encapsulates muscles and separates it from other muscles and allows it to move over other muscles. So yeah, any of our connective tissue that needs to resist stretching in multiple directions. Elastic connective tissue is exactly what it sounds like. Stretchy. Very stretchy, extremely flexible, and I think we're still in what we lectured over last week. This is going to be things like your stomach, your bladder, your so think about your stomach. Your stomach, when it is flaccid, is a tiny little sausage tube, probably no bigger than a bratwurst. But we can certainly start eating and eating and eating and eating and causing it to get very, very large. And we don't want it to split. Your bladder, tiny little thick balloon that begins to fill and fill and fill. The edges get thinner and it becomes filled with urine and then has to be able to contract back down to its regular size. So all of that's going to be our elastic tissue, something that needs to have stretch after stretch after stretch, but always go back to some way, shape, or form its original. That's where we see chronically obese pets. Here's what happens with our chronically obese pets specific to this elastic connective tissue. You put your pet or you put your person on a diet because the only safe way to get rid of weight is to take in less calories than what you're using. Because then you got to break down the stored fat to replace it and make up the difference. But what happens to a balloon after it's been fully inflated for a long, long time and then you let all the air out? Does it go immediately back to its original size? No, it stays all stretched out, doesn't it? Well, how do we get full? When you are eating and your stomach is stretching, you have these little stretch receptors. And when the stretch receptor gets activated, it sends a little message to your brain that says, okay, we're good. Don't bring any more in. You can't take any more. And your brain then sends that message and says, stop eating. And you have the sensation of feeling full. But what happens if your stomach's already stretched out? it's gonna take a lot more food to elicit that sensor and tell you that you're full. That's how on the shows like, somebody mind meld with me. Thank you. The 600-pound life show. And you're sitting there like, what? How? You're like, yeah, for breakfast, I eat 12.5 eggs and 1.5 pounds of bacon and burr. And then I need a snack like 2 hours later. But like, I would literally die. I can put away some food, I would die. So how is that possible? Because of this. They've stretched out the elastic tissue, which kind of compromises those sensors, and they don't get the sensation that they are full.
So when they go, like whenever somebody wants to do, like they do remove part of the stomach, does
Uh-huh.
that ever stretch back out, or is it permanently like at that size?
Oh, you can stretch it out. In fact, if you have ever watched this, it's a fascinating show. But if you've ever watched the show, does anyone in here, have you ever seen it? The 600-pound life? So they will go and get a gastrectomy, which is where they physically, surgically remove part of the stomach and bring it back down to size. And then you sometimes see the follow-ups, and they've started eating again, and they've actually stretched out that pouch. You did?
I didn't know. My family.
No, I meant, I didn't mean you, but a family member.
Yeah, I think I remember my mom had that. It was like a year and a half later. Like they say on everything, and then a year and a half later, they started eating again because they thought they lost enough weight, and then it just sits back down. They goes their weight down.
Yeah. And that's also a big danger with the lap band where they don't surgically remove it. They just kind of tie it off. And then you start eating and eating and eating, and the band will physically restrict the tissue and cut off the blood supply. Big problem.
If you have any animals with like morbid relations like that, do they do gastrectomy or is that?
Oh my God. Okay, now that's a great question. Although from you, anything other than whale question is a great question. No, I'm kidding. We do not. We do not typically do the gastrectomy or the lap band surgery. We do simply exercise and calorie restriction. We do not do liposuction. Liposuction is actually super dangerous procedure. So we don't do any of that.
Like at all?
At
Like,
all.
even like the crazy rich people?
Oh, no. That would be a medical malpractice for the veterinarian if they tried to attempt any of that. The only way is to do blood work to make sure there's not some underlying condition like hypothyroidism, diabetes, something like that. If the animal metabolically is fine, calorie restriction and exercise. We don't do any surgical interventions as far as weight.
So are these stress receptors embedded in this elastic connector?
Yeah, so those sensors, there's just little bundles of special nerves that are embedded in this elastic tissue. Otherwise, how would you know if your bladder was full? The stretch receptor is activated. It sends a message to your brain, uh-oh, we should probably find a bathroom pretty soon. Or, hey, the food is enough, stop eating. And so it's these little specialized bundles of nerves that are embedded in this elastic tissue. Again, your airways, sensor, you have to know how much is enough air. You can only take in a finite amount of air. If everybody in here takes the deepest breath you can possibly take, not only are you restricted from your lungs inflating more than they're able to, but you have a stretch receptor that says, what are you doing? Why are you breathing like this? Because if you continue to breathe like that, you'll alter your body's pH and you'll pass out. It's called hyperventilating.
Sorry, back to the bladder. So like, how can dogs hold it for like hours and hours? Like you can get like bladder infections or other problems. So like my dog can hold it, like 8 hours, 9 hours.
Sure. Well, okay, let me combat it with this. So what is your dog doing probably for 98% of the time that you are not home? So can you not hold it over 8 hours if you're asleep? Well, as you grow older, this, yeah, unfortunately, that is a symptom of getting older, but the dog is probably asleep, and okay, so dogs are not having the little water bottles you guys are drinking from constantly. They'll go take a lick when they're a little dehydrated, their body tells them when to drink. We as humans, I've said it, everybody's breaking out their water bottles. We drink far more water than what we need, which means our body has to rid of it much faster. So that feeds into it as well. They're just not simply drinking as much as we do. We do have some specialized connective tissue. We've got cartilage. We'll talk just briefly about the different types of cartilage. And then bone. Bone is a connective tissue, and so is blood. Blood, even though you don't often think about blood connecting things, isn't blood like the ultimate connection? Blood is really the only communication that some organ packages have with other organ packages and allow your body to work as a cohesive unit because of blood.
What is scab count as a connective tissue?
What is what?
What is scab be considered a connective tissue?
Scab?
Yeah, like when you cut yourself and you get like the hard, like.
So yes, although that would be not technically a connective tissue, that is a function of blood and platelets. So that, the blood being the connective tissue, you're thinking of a scab holding the two edges together. Scab, however, is a primary function of blood. It's not considered a connective tissue simply because it's holding the two edges together. Blood in itself is already categorized as a connective tissue.
So it's just this
You'll-
blood.
Yeah, you'll be getting into, I don't want to kind of put it off, but you will be getting into what is called the clotting cascade, and all of the proteins and all of the things that have to be activated in order for you to form a clot. There's a ton of stuff that I'm not gonna go into that rabbit hole right now because it's not stuff you need for this particular chapter.
So for connective tissue, is there loose, dense, and specialized? Is it free, or are these all a type of loose or dense?
So for these specialized connective tissues, I would say is cartilage, bone, and blood.
But are these considered like loose or dense?
They are considered specialized.
Oh,
So
okay,
they don't
okay.
they don't fall into one of those other
Got
categories.
it. Okay, sounds good. Thank you.
No worries. Cartilage. So we've all heard the word cartilage. Oh no, I ripped my cartilage, I tore my cartilage, I injured my cartilage. But what exactly is it? We got a couple of different types of cartilage depending on its job and its location. Sometimes if you want to see what it looks like, it's called gristle. Have you ever been eating a lovely piece of meat and you bite down on that super, super hard thing that's not bone? It's got a little bit of give, but holy smokes, it'll give your tooth a bit of an ache. That's gristle, that's cartilage, that's part of the connective tissue. A little bit more flexible than bone, and this cartilage does not contain nerves. And basically, what does cartilage do? Again, it's connective tissue, it connects stuff. The one that we're probably most familiar with is going to be the cartilage that is over the epiphysis of our bones. It forms a covering, and it allows our bones to move over each other without directly rubbing. If you have arthritis is inflammation of a joint. Sometimes that will cause your cartilage to be eaten away, and it'll allow your bones to rub directly on other bones, which I can tell you from experience is one of the most painful things you can ever go through.
It's the lack of cartilage when you get your hips and knees replaced or that.
So if you get your hip replaced or your knee replaced, you are physically removing the bones. You don't have any cartilage left. You're removing the whole joint and then replacing it with usually titanium. So our three different types of cartilage, probably the more common one is hyaline. Yes,
So, hey, that's, like, there's no blood, but very little blood.
very little blood and no intervention, not intervention, I'm thinking about the shows now, innervation. So no nerves, no blood. But holy smokes, does it ever hurt if you hurt your cartilage? So if it doesn't have any nerve supply, how is it hurting? Yeah, so what it does, this is where your body is really kind of interesting. If something with no nerve supply or limited nerve supply gets injured, he still's got to tell your brain, uh-oh, something's wrong. Because any pain is your body telling you something's wrong. So what he does is he sends little signals out to all of the tissue around him that does have nerve impulses. And it's that tissue that sends the message, uh-oh, there's something wrong in this area. And then it sends a pain signal, which is technically your brain telling you don't use this thing for a while. I got some work to do on it.
If you like relax, like don't use it, could it possibly go back and like once it's on it completely gone?
For cartilage, it kind of depends. Can you replace it? Not really, no. Can you promote lubrication and cartilage health? Yes. There is in fact a very common supplement you may or may not have heard of called glucosamine. In fact, if you do a lot of workout, don't do it, it's dangerous. But if you do a lot of working out, or if you run marathons, you know all about the glucosamine chondroitin. Glucosamine is something that helps to promote cartilage health, and the way it does that is it helps to just kind of keep it pliable and prevent it from ripping. And then the chondroitin helps to promote the production of joint fluid.
And we
Ms. Huff, don't they give that to the dogs to keep them from having like arthritis?
Absolutely, we do. In all of your joint diets, that's what's added is the glucosamine chondroitin.
But it's the same exact thing, because like at my Costco, like we sell like the dog one, and then it's also glucosamine something else in like the human pharmacy, but it's the same thing.
Glucosamine chondroitin is the exact same thing.
So you should keep them the human one, and they could do
As long as the dosage, you need to calculate out the dosage because the milligrammage on the human one may be different than the animal one. But yeah, you can give it. You can give it to your dogs. Sure thing. As long as the dosage is the same, it's the exact same medication. However, if I'm going
Is
to
that-
hang on one
Is that
second.
what you-
Oh, just 1 second, Charles. So I would be more tempted though for me to take the animal one. Because the human glucosamine chondroitin is going to be about 3 times the amount as far as price of the veterinary one. So I would be more likely, now, would I? No, I would never take veterinary medications. Because they're a fraction of the price, but exactly the same drug.
like prednisone.
Like, yeah, but although technically, if I want to go on record, because I am reporting, it is illegal for you as a human to take veterinary dedicated medication.
Even though it's the same exact thing.
Yep.
Okay.
So like, let's say you need prednisone and your pharmacy is charging you $30 for a 2-week supply on your copay. And you can go to your veterinary and as a technician or someone that works in the medical field and get a 100-count bottle for about $15.
Is that because like one's prescribed and one's like over the counter?
Well, no, they're both prescribed.
Like glucosamine versus prednisone.
Oh no. Well, prednisone is a prescription drug. It's a steroid. I would not give that. No, unless it's specifically prednisone is prescription.
Well, that like what I'm saying is the difference. Like you can like get glucosamine either way, if it's over the counter, but like prednisone, like prescribed, you have to go to the doctor to get it. It's not like
Okay, but okay, now you're off way. So I'm gonna bring it back around. What you're now talking about is prescription versus non-prescription. That's a whole pharmacology thing. You can't go to your store and buy prednisone without a prescription. You can, however, buy glucosamine chondroitin because it falls under the supplement, not prescription.
but there's still like theoretically like same about
Yeah, they're exact same medications. And in fact, the veterinary and the human medications, same company that makes them. It's literally the same medication. If you get cephalexin for a human and cephalexin for an animal, it's even the same pill.
But isn't it stronger for animals because they have a higher cost?
No, the dosage is the same.
You're literally just paying.
The dosage is the same, the delivery is the same. You are literally paying for it being sold to humans. This is now a whole morality clause that we've gone into, like, why can't I just put some in my pocket? Because it's illegal, and I would be derelict and super not a great instructor if I was like, just go buy veterinary drugs.
But that's not something that doesn't happen.
Oh,
Or
never.
that's still definitely like.
That would never, that would never happen.
100% arrested if it happens. I
Yes.
don't do it, but I meant like the actual like morality.
I am not putting myself on any sort of record as saying that I would advocate you taking veterinary medications.
Will we go over morality in like a different time?
You do. I'm being recorded right now. What are you trying to do? Hyaline cartilage, elastic is exactly what it sounds like, and then fibro, resisting stretch, fibrous. So let's just do a wee bit of exploration. Hyaline is the most common cartilage found in your body. It covers your joints. It is clear. In fact, medical terminology, what does hyaline mean? Glass, clear. If you want to see you can see hyaline. So here's your challenge. Go to the KFC and get you a bucket of chicken. I know, right? Get you a leg. It's the easiest one to see. Eat all the chicken off the leg. You know the shiny bit on the end of the bone? You can actually take like a serrated knife and kind of lightly, gently, almost peel it off. That shiny part on the end of the bone is a hyaline cartilage. Elastic cartilage is exactly what it sounds like. It can bend and stretch. One example is right here in the pinna of your ear. This is the pinna. And I can bend and stretch this all day long. No damage going to be done here.
So finish the connection between the ear and
The pinna would be the equivalent of the flaps of the ear.
So that's what you're not going to take. And that's like then they go back because it's like once it's gone.
Once it's gone, it's gone. This is also why if you get the pinna of your ear pierced, do you have blood dripping down your shoulder? No. And the pain that you get from it is resounding pain. Usually you get a headache if you pierce your pinna. And really the worst pain was probably like the heat from your body going, ow, what the holy heck is this new thing in me? But yeah, so the elastic cartilage, still not very well innervated and very little blood supply. That's why you pierce your ears all day long and they're not going to bleed. Hopefully they're not going to bleed. If they bleed, then you've done it wrong. You've horribly, horribly done it wrong. So the pinna though is the ear flap. So if I was a dog, this would be my ear flap. That's known as the pinna.
So in the hyaline cartilage, is that what connects like floating ribs to the sternum, or is it just overall everywhere connected to the ribs, even between ribs?
So you're gonna see the hyaline hyaline cartilage. You're gonna see that in all of the ribs as they attach to the sternum.
Are the true ribs literally not attached to anything on that side, or is there cartilage?
True ribs are still directly attached to the sternum. They do still have cartilage. Anywhere you have more than one bone, you have cartilage. So the floating rib has nothing. The floating rib has thoracic vertebra attachment and then no attachment. It's just embedded in the muscle. False ribs have a bridge. True ribs attach directly. But yeah, your floating rib, that's why it's called a floater. There's nothing there.
What is the bridge made of? Is it,
Cartilage.
is it the hyaline?
So you're up here. So just know hyaline cartilage, most abundant, and it's clear. That's all we need to know right now. It's not that I'm not trying to sidestep your question. I learned last week that if we start going down too many of these rabbit holes, me giving you more information than what we need, it gets a little confusing for people. The hyaline cartilage is clear, hence the name hyaline, because hyaline means glassy or clear. You think if you eat pho, is that how you say it, pho? Pho has a type of noodle called a hyaline noodle, and they're clear, glassy noodles. Finally, we have our fibrocartilage, and this is found between bones, for example, in your spine, areas where we need very dense connective tissue. It really has very little, if any, give. So this would be found in between your vertebra, in between the discs of your vertebra. And do what?
That's the only spot.
It's the only spot we're bringing up right now. So those are the three different types of cartilage. Hyaline, most abundant, clear and glassy. Elastic, can stretch and stretch and stretch over and over and over and not be damaged. Fibro, very fibrous, resist stretching, and most typically found in your vertebra of your spine. Yes, sir.
But you saw, it doesn't stretch, but if you were to like, let's say you were to like bump your head, it does contract, so it compresses, or does it stay stable?
So what you're thinking of is the discs in between the vertebra, which act as a shock absorber.
Okay.
What this is think about, so I have a vertebra. I'm gonna wrap the vertebra in saran wrap. I'm gonna put a marshmallow. I'm gonna take a second vertebra, wrap it in saran wrap and stick them together. The marshmallow is the disc, the saran wrap is the cartilage.
Okay.
Does that make sense? Okay. So yeah, if you have something come down on you that compresses, what happens to the marshmallow in between these two discs? It's gonna spurt out. That's a ruptured disc. If I twist these the wrong way, can I rip the saran wrap? Two different injuries.
Thank you.
Of course. Bone. In fact, our next chapter that will be starting either tomorrow or Wednesday, it'll be our last chapter in this section of anatomy, is bone, the skeletal system. Now, the great thing is you've already done the skeletal system in MedTerm, so it'll be quite a bit of review. Bone has a lot of blood supply. Anyone in here ever broken a bone? Yeah, what happened to the area around the bone? You ever broken a toe?
Well,
It swells, but what else? It goes huge purple black bruise. I did a shearing injury on my ankle, and I had a bruise from my, so it was my medial malleolus, which is your inside ankle knob, and I was picking up a sample of tile, and it was kind of put into this little sample where there are 5 or 6 tiles. And I was picking it up and I dropped it.
well,
And it came down and sheared, and just like the edge of a glacier, sheared off my medial malleolus. And I had a bruise from my toe above my knee. If you've ever broken a toe, your whole foot will turn black. Yeah, I fractured my skull, my whole face, whole side of my face was just a huge purple bruise. Lots of blood supply. Why? Because we got a bunch of blood cells that are made in our bones. We gotta get those blood cells out, the wandering cells. Some other things that we have that we are gonna go into a lot more detail are tiny, excuse me, tiny openings in the bones that help us. Bones, when we think of bones, we're looking at something like this. Something that it is inanimate, it is not alive, this is dead. This is dead bone tissue. But normally bone tissue is incredibly dynamic. It is a living connected tissue. And I need to be able to get blood in and out of it. So unlike our soft tissue, where I can just kind of feed a blood vessel in, I need to create tiny microscopic tunnels that allow the blood to go into the tissue. And these little microscopic tunnels are known as haversian canals. Here we have a microscopic view of a haversian canal. It's just a tiny gopher hole inside the bone that allows blood supply and nerve supply a place to enter and exit.
Different from the foramen.
Different from the foramen, yes. The foramen will allow larger nerves, like your foramen magnum, which is a big hole in the back of your skull that allows your spinal cord. You have your obturator foramen, which allows ginormous, bigger than your sciatic nerve going down to help your back legs. These are microscopic just to let blood supply and tiny nerves in. And then, of course, we've all medical terminology, the periosteum. Oh, go ahead, Zoomer. Does someone have a question on Zoom? Guess not. So peri, medical terminology, peri means what? Around osteum, the bone. So this is just a membrane that covers the bone.
Osteoid? I'm sorry.
A what?
The osteoid? That first one, rock matrix, osteoid?
Oh, osteoid just means bone-like. So the ground matrix of the bone, the two primary minerals that make it up are calcium and phosphorus. That's all it's saying. Calcium, phosphorus, and different types of fibers. The way that your bones are made are really dynamic. When we get into, again, I know you guys, I love you desperately. You're like, teach me all of the things. We're going to get into how bones are formed and then reformed. Because just like my skin tissue, bone cells don't live forever. But I can't shed them like I do my skin. So I have other special cells that come in and break down bone. And then cells that come in behind and reform the bone. And that's how you can heal breaks. But that's also how you can manipulate the shape of the bone. You ever seen a cowboy? Think of a cowboy's legs. Why? Because their legs are constantly around and they, as the bone is broken down and reformed, it's being reformed into the shape that it is most commonly in. Yes, we're starting to physically alter the bones in our hands and physically altering the joints because we now hold our phones like how? Like this. So we have this and we're altering the shape of the bone in our fingers. And then finally, blood is a liquid tissue. It contains our wandering cells. It contains our oxygenation cells. Our erythrocytes are the red blood cells that bind with oxygen and carbon dioxide, transport nutrients. Leukocytes are the white blood cells. Those are the wandering immunity-related cells. And our thrombocytes are the platelets, which get into the whole scabbing conversation that we had earlier. Platelets are the initiation of a scab.
Why is it considered atypical? Because it has like so many different components, or just because it's not like a hard substance as like the other ones?
I'm not understanding the
Because
question.
it's the most atypical type, like what is it mean in this instance of atypical?
So what it means by atypical connective tissue, when you think of blood, does the word tissue immediately come to your mind? It does not. We consider it a connective tissue though, number one, because it connects literally every system to every other system, and its general makeup having a liquid ground substance, cellular makeup to it. The makeup of the blood is very similar to the spaghetti that we talked about last week. It's just far more fluid. So when we say it's atypical, it just means when I say the word connective tissue, you immediately think things like the periosteum. You think of ligaments and tendons, that kind of connective tissue. This is atypical because it's not the one that we immediately think of, and it's far more liquid than any other tissue in our body, still considered a connective tissue. So that's what we mean by that. All right, comments, questions, concerns so far? We're having some great dialogue today. I love it. We've also got some membranes. Guys, we've already talked about all of these. This is 100% review slide. We have mucous membrane. Somebody tell me what comes to your mind when I say mucus. Goblet cell. And what is mucus? It is a very viscous substance. It's very thick. Serous. Very thin, very watery. Saliva would be an example. Cutaneous.
What?
Yeah, so would be to exit to the outside environment. So you would have sweat glands, sebaceous glands, which make the oils in your face. And then synovial. Yeah, synovial membrane inside your joints.
That's like what's in the bursa sacs, right?
That is exactly. So we have synovial membranes that create synovial fluid, that fill up the synovial space in the synovial joints. That's the one where the guy was like, oh my God, that's due today. Name everything synovial.
So this is no longer connected tissue. This is like only connected.
So this is still under the category. This is kind of a subset. These membranes, there was nowhere else to put them. And we were like, well, we have every tissue in your body has to be one of these four. Every single solitary piece of tissue in your body has to fall under one of these four categories. The problem is some of them really just didn't. And so what we ended up doing was with our membranes, because of their form and the way that they function, they are most closely represent the connective tissue.
Okay, thank you.
So our mucous membranes produce mucus. They control what enters and exits your body. Some of our mucous membranes are very important to us as technicians. For example, CRT. Who knows what CRT stands for? Yeah, our capillary refill time. We're going to use the gingival mucous membrane to tell just how the heart is beating. Your mucous membranes in your mouth, these or in general, very, very absorptive. You can rub a little stuff on your gums and have it absorb directly into your blood. In fact, we have a lot of medications that we give that way. If you've ever taken a sublingual where you put the medication under your tongue and it immediately gets absorbed into your blood. We have pain medication that we can give that is, all you gotta do is rub it or just spray it in the mouth. Absorbs very, very quickly through the mucous membranes. Nice for our cats, because when they go and hiss at you, you just spritz it in their mouth. And then it absorbs in there. Not a whole lot of shocking new information on this one. I'll give you guys a minute. Yeah, I'm excited to get into the skeletal system because I think about 95% of it is reviewed from medical terminology. It's primarily bone identification. Where are the bones and what other bones do they join up with? And then talking about the words you've already heard of, like condyles, phobias, fossas, that sort of thing. So it'll be a nice chapter to end the term on because your brains are so overloaded right now. It's a review chapter. So I like to end the term on that because it does give your little brains a bit of a break.
So mucous membranes aren't connected to a single like system.
No.
Do you know about this test review?
I would be anticipating probably Wednesday. It's not, I know we have 2 more to go, but they're super, super short. And so the majority of the new information that doesn't get recovered are epithelium and connective. So there's a picture of our CRT. Serous membranes, they produce watery. This is going to be an example of your, remember a million years ago when we talked about, do you need me to go back? I can go back. Of course, yes, please, I'm sorry. So a bazillion years ago, it feels like, do you remember when we were talking about the pleura and the peritoneum, and we had the visceral and the parietal? One covers the cavity, one covers the organs, one is in the chest, one is in the abdomen. Those are all serous, watery fluid producing membranes. Good? Okay. So because they are water producing membranes, that's where we talked with that chapter that some stuff can sometimes go wrong. If these watery producing membranes start overproducing, suddenly now I'm going to have fluid accumulating in the chest or fluid accumulating in the abdomen. I think you've probably heard these terms. I know we talked about these 2 terms in this class. But a large amount of accumulated fluid in the chest is called effusion. So if it's originating from the pleura, pleural effusion. If you've ever seen literally any medical show ever on TV, you've heard, oh my God, he's got pleural effusion. We need to place a chest tube, stat. What it is. A large amount of fluid in the abdomen is called ascites.
Was ammonia considered an agent with its water, right?
No. So what I am referring to with effusion,
It's the
from the membranes, then the fluid is going to accumulate in the space between the lung and the chest cavity, potentially causing the lung to collapse. What you're referring to is an increase in mucus production inside the lung itself. And that's when you're coughing it up. I can't cough up pleural effusion because it's not inside the lung. That's okay. Does that make sense though? Okay.
What would the buildup?
Do what? I'm sorry?
What would cause a buildup like that?
1,047 things. Trauma, infection, different viral diseases, really a whole bunch of other
So it's
different.
an overproduction, not really like a cause, like it's not like flowing in and stuff, as you can open produce.
Yeah, sort of. Okay, so 5 weeks ago, the freeze hit, or however long ago it was. I have water pipes in my house, okay, that transport fluid. What ended up happening due to trauma, one of those pipes broke. Now, does it mean that my house is producing more water than usual? No. It means it's leaking out in between the wall and my house. That's what I'm talking about. If I punch you in the face, not that I'm going to do it, but if I punch you in the face, what happens to your face? It swells up because of trauma. If you get hit by a car and your chest gets a massive jolt, can my chest swell? No. But what can happen is on the inside, I get that fluid production. That's what causes your eye to swell when I punch you in the face, is fluid production leaking into the tissue, and sometimes even blood from damaged blood vessels. That's what we're talking about here. Is it an overproduction? Sometimes. But overall, pleural effusion is simply an accumulation of fluid between the organ and the cavity.
Is the cities,
Ascites. You're fine.
ascites, that is fluid in the abdomen that you don't want, because we do have fluid in the abdomen.
Oh yeah, but this is not fluid that we want.
Okay, got it. Thank you.
This is super bad fluid. We do not want ascites in the abdomen. That's
So is there
ascites.
like other terms for like fluid, excessive fluids elsewhere? Or is it just for the abdomen?
The two terms that we use predominantly are going to be effusion and ascites, specifically referring to the thorax and the abdomen. This is a puppy with ascites. And we can get this from worms. What happens if I take my hand and I push on this abdomen, it's gonna have a wave, just like if you push on a water balloon and it jiggles. That's what's gonna happen here. Yeah, so for me to say, well, what causes ascites? Well, a million things. Heart failure can cause ascites. Parasites, trauma, disease. Ascites is simply a clinical sign, meaning an accumulation of fluid in the abdomen.
Would you be able to immediately tell them the difference between ascites and bloat? Like they feel something different?
Yeah, because bloat is air and ascites is fluid. Bloat is acute. It's going to happen with immediate repercussions. You're not going to go to bed tonight and wake up and have your dog look like this because of ascites. It's going to be a much more chronic. This is just showing that membrane that I've pulled back. Some of you like to see the medical stuff. All right, we're going to finish up with our cutaneous and synovial membranes, and then finish up with our muscle and our nervous system. So yeah, we've only got about a few more slides left. So this will be finished up tomorrow. We'll anticipate doing our test Wednesday afternoon.